Hello, everyone. I'm Jabji, and welcome back to Aditya Birla Health Insurance's Health from Home series. We are in phase 2 of India's COVID vaccination drive, which has now been opened up to certain categories of general citizens. In fact, very recently, the government announced that now vaccines will be available to citizens above 45-year-old, and that's very as recent as 1st April onwards. Isn't that a great news for all of us? But it's understandable that with the new vaccine coming, there are a lot of doubts in minds of people. What are the results of these vaccines? What are the side effects it comes with? Should you take it or wait and watch before you decide to take that vaccination? So, in our last session of Health from Home, we spoke about certain doubts and queries about COVID vaccinations with Dr. Nikita. And today, in this session, we are going to move a step further. We are bringing to you a doctor who has actually taken the vaccination and is here to tell us about his experience. Please welcome Dr. Chinmay Patkar. Hello, Dr. Patkar.
Hi, how are you guys doing, man? Thank you so much for bringing me on this.
Hi. So Dr. Patkar has been instrumental during the current pandemic, working very closely with COVID positive and negative patients at Insight Mind Care Center, Thane. He has assisted over 200 surgeries, especially in the field of oncology. He is also an American Heart Association trained physician for advanced cardiac emergencies and stroke management. Thank you so much, doctor, for joining us today.
Thank you so much, guys. It's actually lovely being here. Please continue.
Yeah. So, doctor, you've been the first few to have taken the vaccination, right? What has been your experience so far?
Well, the experience has been really great. In fact, the vaccination drive has been planned really well. The centers are allocated all over the city, whichever city you're from, whichever state you're from. There is a limited number of people that get to come at the center at a particular day at a particular time. So there's a good amount of social distancing that is maintained. So obviously, in a country that is so heavily populated like India, that had been heavily struck by the COVID-19 pandemic so deeply, I'm actually very glad to see how well it has been planned and organized and how efficiently the vaccination drive has been going. And so it's been great actually since I received my doses.
That's great. And that's relief to know that social distancing has been followed and the processes are smooth for consumers. So which vaccination did you go for? And
I went, yeah. Sorry, continue. I'm so sorry I cut you.
You can, which vaccination did you go for? There are two vaccines as we know, Covishield and Covaxin.
Covaxin, yeah. So I went for Covishield. That was what is available for emergency use right now as well. You do have an option for Covaxin as well. Currently, the major load for the vaccination drive in India has been taken up by Covishield.
Okay. And how different are the two vaccines?
They're not really any different. Any vaccine, it's not just Covishield or Covaxin that is currently available. At the same time, the other vaccines that are not yet in our country, like recently Johnson & Johnson developed their single-dose COVID-19 vaccine. Finally, all the vaccines do the one thing that they are made to do, that is prevent any complications due to COVID-19 infection or any sort of severe complication that can affect the normal health of a person. So all vaccines, regardless of what their name, make is, or which country of origin, they do 100% effectively work against COVID-19.
Okay. And we all know that COVID vaccine has been developed in a record time. What are your views about its success rate?
A record time, but with precision is what I would say. So before I even go on to the COVID-19 vaccines, I would rather educate whoever's listening to us right now or is seeing this conversation right now, that any medicine, let it be a vaccination, let it be a simple pill, or even if it is something like a paracetamol, before it is given to the public, it goes through a bunch of clinical trials. Now, what these clinical trials do is that they take care of every aspect related to the medication. It can be any side effects, it can be how it functions with different people, with different age groups, how it functions with people with different diseases. Sometimes people might have certain comorbid conditions. Some might have high BP, some might have diabetes, whatever. So every vaccine, every medicine goes through this clinical trial, and they're done in a very pristine, very precise way. And all of the vaccines that are out there right now do the one thing that they set out to do, that is they prevent any serious infection due to COVID-19. Anybody who has been vaccinated or will be vaccinated in the future at least is safe against the infection in such a way that it doesn't feel so overwhelming. The initial problem that we guys had faced, everybody had faced in this country, is that the hospitals were getting overwhelmed by patients getting admitted. There was a lack of care available, lack of system in place. Now what the vaccine does is that it prevents that from happening, and every vaccine does that 100%.
Yeah, that's actually great. And so, like you mentioned, that there are people with comorbidities, there are people, senior citizens, somebody may have certain issues. So, it also, so the vaccination, as we all know, we've heard, it comes with certain amount of side effects.
Right.
So, what are the medicines that one should take to overcome those side effects?
All right, that's a good question, actually. And it's actually going to be a myth buster, because I'll give you an example. A simple example is, in case you've just fallen down and you get a scratch by a rusty nail or like just soil, a doctor advises you to take a tetanus injection. Am I right?
Yeah, that's true.
That is a tetanus toxoid vaccine that is given to you. What does the doctor tell you? Do din tak you might get fever, you might have some pain, some swelling. That is it. If anything happens beyond that, you can always come back to us and we can see what can be done. Am I right?
Yeah, that's true. That happens, and we're aware of it. So,
That is the exact same thing that happens with the COVID-19 vaccination. It's really nothing different. It's not that you have to be worried about taking, oh my God, like, I've got a, like something is happening to me, I should take a medicine for it. No, any side effect that happens through this vaccine is very mild, and it'll subside by itself in a day or two, to be very honest. And in fact, to prevent any adverse reactions happening, the people who are receiving their first doses, right? The person who receives their first dose is kept in the vaccination center for 30 minutes under observation to see if they are having any problems with it. Are they feeling any discomfort? And as per my own personal experience, and as per whoever, one of my colleagues or anyone who has gone through, they have not noticed anything severe that has happened.
okay, that's a good news, in fact, and solves a lot of doubts in the mind, honestly. And to that, what are the various side effects that we've seen that people have come across?
The side effects are usually very mild. They are the most common ones will be, you might feel pain at the injection site. As you know, it is given in the arm. You might have some swelling, which is again a natural thing after that you might take an injection. That is very common. Some people have also experienced a low grade fever, sometimes dizziness, tiredness, fatigue, joint pain, bone pain, and like sometimes they feel like not eating too much. But that is again, these are all very self limiting, very mild, and that whole ordeal just gets over in a day or two. This is from my own personal experience, from the experience of my colleagues who I've spoken to, and a lot of patients that I've spoken to, and friends who have taken the injection right now, who are about the age of 45,
So,
50.
so we needn't worry about it. There's no need
Nothing,
to,
nothing to worry.
it's regular,
These
like
are,
the vaccine we take.
yes, it's a normal side effect. I'm sure it has got lesser side effects than most of the medications that we might take as people. And it's just that because this pandemic has affected all of our lives so deeply, we are obviously bound to have some sort of apprehension, some sort of nervousness towards it. Even though it might be something that will be helping you, we'll always be nervous. We'll cross question it. So which is completely natural again.
And how long does this protection from the vaccination last?
All right. So the doses recommended are 2 doses at the moment. They are ideally the first dose when it's given. The second dose is recommended at, I think, 4 weeks to 12 weeks after the first dose. But obviously, permanent a positive immune reactions comes to the body around 15 days after the second dose is given. So it's essential to not delay the second dose if you have taken the first dose, that is. And the protection lasts at least for 4 months right now.
Mhm.
And at the same time, what the vaccine does is that it prepares the body, our human body, to fight a COVID infection if it has even occurred in the future, or it might occur. in the best possible way, such that an overwhelming infection that usually hospitalizes people, people get worried about it, there's so much loss of life happening because of it, seems like just another cold, and it doesn't require serious medical intervention.
Hmm. All right. So from the first vaccine to the next one, the government had said that it is going to be 4 weeks that you need to wait for. Recently, we heard it can be 4 to 6 weeks. So, is there any particular date that we must follow, or within that time period of the 2 week window is when somebody could go for the vaccination?
So yes, ideal that was started with was the first dose, and then you have a 4 week gap, and then you take a second dose. And post the second dose, around 15, 20 days later, you get the immunity developing against the COVID-19 infection. That is ideal. Recently, there was a study by the Oxford team that said that if you delay the second dose, there is a chance of increasing the immunity even more. But and even if you go through the Covishield brochure or Covaxin brochure, they all say 4 to 12 weeks. They've given that broad window. But I personally feel, and I'm sure many of my colleagues in the medical field do feel, that it's better to take the second dose at its intended time, because obviously the a sense of permanence in terms of immunity against the infection really comes after the second dose, and it really doesn't cause any hassle to anybody. So it might as well just take it.
Okay. And I'm sure lots of your patients must be approaching you with queries. And let me put it, a lot of queries. And most of us have it. The ifs and buts related to vaccination. What are those some of the very common worries that you come across?
Common worries that we usually come across, number one, actually more than physical worries, it's apprehension towards the vaccination. There's a lot of noise, to be very honest, because it's such a hot topic, right? The pandemic has affected our lives so deeply that everybody, and it's a dinner table conversation, is there in your offices, it's there between your friends. It's the most common question that I usually get is it even going to be effective? I've heard that so many people have gotten a COVID-19 infection even after the vaccination. Now, where you've heard this from, whatever, obviously nobody knows, but there'll always be WhatsApp forwards and a lot of things going on. So that'll be the first and important query. And I would like to address that today because um, the aim of the vaccine, the aim with which these vaccines have been made is not to prevent COVID-19 infection. The aim of these vaccines is to prevent any debilitating illness that gets caused due to COVID-19. Like I said earlier on when we were talking, is that the major problem came in when so many patients were getting admitted into hospitals. There was a huge difference between patient care and how they were able to cover it up, and eventually our medical system was resilient and overcame that. But there is always, you hear about, like, there are permanent issues that happen with people who have already gone through the infection once and all of that. So the main aim of the vaccine is to prevent that, to prevent you getting hospitalized, you having any serious complication, you facing any loss of life. Even if you, by the stroke of bad luck, even if you tend to pick up a COVID-19 infection in the future post the vaccination, it will not make you feel that overwhelmed. It will be just like a simple cold, and it will not cause any deep grave issues where you'll have to be admitted, where you'll face complications, there might be any loss of life. That would be the first thing I'd like to clear. Second thing is second question I do get, more than side effects, trust me, side effects are not even people's concerns right now. The second thing is, we've heard this one vaccination is 95% efficient, the other one is 61%, one is 81%. I will only wait for that one to come, or I will not take this one. So there's a huge misunderstanding. We usually, as people, associate percentages as ye percentage acha hai, 70 के ऊपर distinction, 70 के नीचे first class, like,
We've
that's
been
a,
trained like that.
we've been trained like that, exactly, right? That's what is stuck in people's head. Now I'll just clear out the percentages that you hear in the news about the vaccines, or not percentages about how they are efficient. It is a term called efficacy. Now, what efficacy is, it's a medical term that is used in clinical trials. That is, you have two sets of groups of people. One group gets the vaccine, the other group doesn't get the vaccine when the trials are going on, when the vaccine is being tested. neither do the people who are getting the vaccine or not getting the vaccine know that they're getting it or not getting it. Neither the caregiver who's giving them know or know if they're getting it or not getting it. It's called randomized controlled trials, so that it is a complete unbiased, unadulterated opinion about how effective a vaccine is really. Now, in that study, at that point of time, whenever that study was done, there are numbers being seen where 95%, if you've been vaccinated, people have 95% less chance of getting an infection. That is what efficacy means, really. And again, when you see these numbers, these clinical trials were done way earlier on in the infection, when we were not so overwhelmed by the number of cases, probably earlier on in last year. Towards the mid part of last year, towards the end, you started seeing such a huge spike in cases, right, towards mid of 2020.
Yeah.
And certain clinical trials took place at that time in different countries, not even in India specifically. So when you have different countries, different time of infection, there are so many variables that come into play, right? So basically, the efficacy is not a measure of efficiency or how successful the vaccine is. The vaccine is 100% successful against preventing serious infection due to COVID-19. Efficacy is just the percentage, how much percentage are you safe from getting it in the future? But
Hmm.
finally, what it's set out to do is prevent any serious injury to you due to that infection. And every vaccine does that 100%.
Yeah, so it's completely safe, and we needn't worry about which vaccine really is better
Yeah.
or safer, etc. So I
Yes.
think that
Yes.
let's.
Certain do we do get a few more questions, something like if we do have an allergy, we have a history of allergy, let's say I'm allergic to a substance, for example, should we take that vaccine? So if you have a history of allergy, you can always tell your healthcare provider, you can tell the vaccination center that you're going to. Mostly the substances that are used to constitute the vaccine are the ones that prevent maximum allergy. To be very honest, it will not affect you, but always it's good to inform. It's always good to inform if you, especially these questions we get, key, what should we tell to the vaccination center when we go there? You should definitely tell if you have any allergies, if you're on any medications. That is, like sometimes people are on blood thinners who are cardiac patients, they're on blood thinners. You should always inform that. If you have a fever, if you have currently an infection, which may not be COVID-19, it might be just a cold, a cough that might cause a fever or anything. So these are certain things that people ask usually.
Okay. So, like you mentioned, that people are on medication, and therefore you should inform if you have a rash. Is it important to stop medication, certain medications, a few days before taking the vaccination?
Only if there are certain very debilitating ones. To be very honest, most of the medications that we are on, or any patient is on chronically, are usually heart medications. You have your diabetes medications. Most of the medications don't cause any problems with any vaccine of sorts. The ones that are some of them which are concerning are any medications that can cause a reduction in your immunity. Sometimes people are on any some sort of steroids. Any anti-cancer medications cause reduction in immunity. Blood thinners also cause a lot of blood reactions. So these are the medications that you should definitely inform your doctors or the vaccination center, because then you'd not be ideal to take the vaccine at that point of time. It might have to stop, or after it, you will have to take it a bit later.
Okay, that's an important piece of information, I think, and to be taken care of. And what are the other precautions you think that should be that one should take care of after the vaccination is done?
After the vaccination is done, number one, just because you have received the vaccination, please do not take your life lightly. Please do wear a mask, maintain social distancing, do not take it lightly. आज vaccination ले लिया, कल 100 लोग के साथ शादी में गए, please don't do that, because you don't want to risk anything. Currently, we were all getting slowly happier that the cases were reducing, and now suddenly we are seeing a sudden spike in cases, especially in Maharashtra, especially in Karnataka and a few other states. So we are still young in the history of this disease. Even if you might have received a vaccination, please do not take it for granted, and make sure that you are safe at all times. Make sure you sanitize, make sure you are socially distanced, and you're always wearing a mask.
So the key rules that we've been following stay the same, and we must
Yeah.
follow those. And are there any long-term side effects that have been reported, or something that we should know about?
Not really. There are no long-term side effects. Obviously, like I said, once you receive your vaccination, you are kept 30 minutes for observation to see if you have any immediate side effects. Those are the ones only if they are caused, then okay, this is a problem. There are no long-term side effects as of now that have been reported in trials as well. Obviously, there's a lot, like I said, this disease has affected our lives so deeply that there's always a conversation about it. But most of it is very dumbfounded. It's not very educated conversation. There are always WhatsApp forwards which are clearly not medically making sense, or it's always things always on the news and all that might kind of scare a lot of people. But I think you should, I hopefully through episodes like this or like podcasts or where you guys are giving the right information to the people, that feeling of being scared might reduce and people are more confident about what is going on around them.
Yeah, that's important, and especially to debunk the myths that are really associated today with vaccination.
Most important, yes.
And also, doctor, what about people who are homebound, who cannot actually go to a center? Are there any facilities where somebody can come home and give vaccination?
Currently, the first phase involved all the healthcare workers, medical workers. Second is now they have started vaccination for elderlies above the age of 55 as well, who have comorbid conditions, might have some illnesses right now. Right now, the focus is that they have not yet made a provision for homebound or bedridden patients, as whatever you might want to call it. And I'm sure there is a conversation that has been started about it, because this is a huge sector of the population that does require the vaccination as well, though they are strictly restricted to their homes. And I'm sure soon provisions will be made for that as well.
Yeah. And what about when you're going for vaccination? Is there something that one should follow in terms of dietary restrictions, or the kind of nutrition you should take, what you should eat before and after the vaccination?
Oh, nothing, really, nothing. There's always, you can always have your breakfast and just go. I think the timings are usually from 9 a.m. to 4 p.m. or till 6 p.m. for vaccinations. Every day it's going on. You can always see that on Cowin, the .gov.in website, as well as you can link your Arogya Setu account to that. There is no restrictions like that in terms of diet or anything that you should do. It's always advisable you eat something and go for any vaccination, because, or any medication also like that, because people are nervous sometimes. It does kind of make you a little worried and all of that. It's always good to have some food, take the vaccination, sit there for 30 minutes and then go home.
Yeah. So don't really need to worry about what to eat
Nothing.
or not to eat.
And the vaccination centers are heavily equipped with a lot of ORS, a lot of fruit juices, anything that you might need apart from just medication. In case if you start feeling dizzy or if you start feeling weak, there are biscuits available. There's all of that provisions have been made, and that's why I said it's been done really well, and it's impressive that our country can do that in such a large scale in such short amount of time.
No, that's really, really great. I think, and it's much needed. And government is taking all the corrective sort of actions and measures to ensure everybody is getting vaccinated and doing it really well, I think.
Yeah.
Doctor, I had another question that can the second dose of COVID vaccine be taken? Can we take a different vaccination the second time? Like there are multiple options available. Can we switch the
No.
vaccination?
Ideally, it's ideal if you've taken one vaccine during the first dose. There is no need to take a different one. You can just take the same one. That's not going to do anything different for you. If your body has already utilized, let's say, for example, Covishield for the first dose, your immune system will build up faster having the second dose of the same vaccine. Then you adding another thing separately.
Okay. So is there a set, again, you need to register for it, or the first registration would work for the second dose as well?
Oh, no. You have to, so minimum 28 days to hey, obviously, you have your 4 weeks. But it advised that you go online on, like I said, on cowin.gov.in, or you can go on, you can go through Arogya Setu and you can book your second dose appointment as well.
Okay.
It's not yet automated.
Okay.
It's not automated yet. I mean, obviously, it takes time for the patient data or any person who's gone on, let's say, date number 1, and for it to be fed in your accounts already. It takes some time. So rather, I'll say be proactive. Remember when you got your first dose, and I think before your second dose, you can always book a date, and you'll immediately get it to be very honest. There isn't too much delay.
Yeah. And is even after taking the vaccination, is one prone to get COVID-19? What are the
Like I
chances?
said, before, the number one, the efficacy rates are more individual than an actual judgment of how good the vaccine is. If you have taken a vaccine, you are a certain percentage safer than a person who has not taken the vaccine in getting the COVID-19 infection. That is the most important, number one. Number
Mhm.
two is that obviously you have to still maintain social distancing. You still have to be careful. You should not put yourself in harm's way and take the risks and try to push yourself because you never know. Like sometimes, especially people who are older in age and all that, are more susceptible to infection in general.
Hmm.
Number three, yes, there is a chance you might get, but again, even if God forbid you do get, that is again a very very rare case, like an extremely rare case. Even if you do get, infection will not be as critical as we have heard or we have seen them. It will always be more like a common cold because your body has already built up immunity against it. Your body is already fighting it from the inside because of the vaccination.
Hmm. Yeah. Yeah. And is it necessary if somebody already had COVID? Is it necessary to go for the vaccine? Because as they say, antibodies stay. So do you really need to go for the vaccination in that case?
Yes, yes. Even if you have been, you previously, let's say, have had a COVID-19 infection. I've had patients who have been previously infected who have healed properly now and are currently have booked their dates for their COVID-19 vaccination as well. It's completely fine because again, this vaccine boosts your immunity more than what a natural infection would have done.
Mhm.
The reason why we got the infection in the first place is because somewhere our immunity was weak, somewhere something was not going right. That's why they said that people with diabetes, people with conditions should immediately not go outside, not interact too much, stay safe, and stay home. So even if you have had a COVID-19 infection before, the antibodies that will be developed due to the vaccine will be much stronger, much more efficient than the time when your own body developed.
Hmm. Yeah. I think really, really, you've debunked a lot of myths and given us a lot of sort of cleared a lot of our doubts about it. Thank you so much for that.
No, no.
And to all our viewers here, I hope this was an insightful session for you guys too. And in case you guys have any questions, you can post those questions in the comment section, and we will definitely come back to you with the answers from Doctor. And thank you so much, Doctor, for joining us. It was
Thank you so much for having me because it's very important that people do get vaccinated. Every vaccine that is taken by a person, you're one step closer to defeating the disease globally. So please, guys, go for it.
thank you so much.
Take care. Thank you.